Joe Freudenberger, CEO for OakBend Medical Center in Richmond, Texas, coming to you today with another Cup of Joe. Conversation about healthcare topics that's not always as familiar as it needs to be for us to be careful about our health and the health of our loved ones. So I'm joined today by one of our family medicine residents, Dr. Faizaan-Ul Haque. Got that? I was going to go with a hawk, but I know it's a huck, like truck.
Yes, sir.
Okay. So we're going to be talking about back to school physicals today, something that can easily get overlooked and has serious implications when we do so. So let's start off with just generically, who needs a back to school physical? Is it all kids or only kids in extracurricular activities? You know, what's the scoop there?
Of course. First off, thank you for having me, Mr. Freudenberger. I really appreciate it. Good morning.
Good morning.
I would say all children need to have a back to school physical just to make sure that they're meeting their developmental milestones and make sure they're good to go back to school and make sure we're covering all our bases for the kids and their families.
So even if they appear otherwise healthy, they seem to be hitting all the marks, but you're still saying get a physical. It's a precautionary thing. Pick up things that would maybe otherwise not go noticed by somebody that is not a trained professional in doing so. Okay.
Absolutely.
So what does a typical back to school physical involve?
Right. So first off, it involves informing the parent or the guardian of the child that, hey, we're going to be examining your child to make sure everything is okay. Now, what that includes on my part is I look at, for example, their nose, their eyes, their fingers, their hands, their feet, their abdomen, listen to their heart and lungs. I look at their mouth and their teeth, make sure everything is where it's supposed to be and it's functioning how it's supposed to be. The goal of the physical is not to scare the kid or the child, just let them know, hey, you're doing okay, you're doing a great job.
Okay. Is there anything in particular that you're looking for that's a more common issue that can oftentimes go unnoticed?
I would say scoliosis.
Okay.
That's something that I think we can.
And what is scoliosis?
That is a curvature of the spine that's greater than normal. That's a very simple way to put it.
Okay.
I would say that goes often missed because I think a lot of kids, myself included, we slouch a lot, and so we can just assume that's a posture thing. Sometimes it can be a spinal problem. So it's important to catch that early.
So if a kid is playing sports, are there additional things that you look for?
Off the top of my head, I would say two things that we look for as doctors is their heart and their lungs to make sure everything is working the way it's supposed to be. We feel their pulses, listen to their heart sounds, make sure they're breathing in and out normally without any wheezing like asthma or something like hokum, the cardiomyopathy that we see a lot of unfortunate athletes suffer from when they're on the field or the pitch and they pass out. Those things that we're trying to catch.
Okay.
Yeah.
Now, kids, unfortunately, like adults, have chronic conditions like asthma and allergies and ADHD and diabetes and a host of other things.
Right.
I would assume most of those kids that have that are seeing a doctor routinely. Is a physical still necessary if you're under the care of a physician on a going forward basis?
I think it depends on the case of the child. If the child is seeing their primary care regularly for follow-ups, it might not be necessary. Maybe for extracurriculars, they need to sign up on a document. But if that child is only seeing, for example, an ADHD specialist, if only seeing a psychiatrist or somebody in that field and not seeing primary care, that child should definitely see somebody to evaluate that.
Okay. All right. So, is an annual wellness exam and a sports physical, are they different or is there benefit in both?
They are similar yet different.
Okay.
I think the similarity is that we are examining the child to make sure that things are where they're supposed to be and how they're operating well within their limits. A sports physical is definitely much more superficial. A wellness exam is much more thorough. Significantly, we're definitely evaluating things top down. Sports physical is mainly to make sure that they're able to perform in their respective activities.
So let me just make sure I got my language right here, and I'm the one who confused it. So an annual wellness exam, is that the same thing as a back to school physical?
No, that's technically an annual physical examination.
Okay. Is that something, you don't have to do that before school or what have you, you just need to do that on some type of regular basis?
Yes, sir. Just if you, sorry to cut you off.
Go ahead. No, please.
But if you combine both, it would save you time. It's just important to let your provider know that, hey, I'm looking to do both today. So the provider knows that we're going to be doing an extra long examination today.
Okay, good deal. Now, as a parent, are there things I should be bringing to the physical, to the exam that helps things go smoothly?
I would say your questions about your kid, excuse me.
Good.
It makes a big difference if we know what your concerns are. If you notice anything, odd habits, odd behaviors that you think are concerning, that's always important to bring.
Okay. Or physical issues that we've noticed and
Yeah,
we
yeah,
wonder about wheezing or what have you,
absolutely.
Okay. All right. Very good. So is there a time that's better than another time to get a back to school physical? I remember when I was a kid, I think my mom would remember it at the last minute, and we'd go rushing about trying to find an appointment that would get the back to school physical done.
Right.
But I presume for a sports physical, you have to do it before you start sports.
Yeah.
But a back to school physical, any particular time better than another?
I would argue whatever fits the parents or guardian schedule first. I'm sure they're all very busy with stuff. As adults, we don't get summer break.
Okay. All right. Sure.
I think during the summer break is the best time to do it. If not, before the child has soccer or football going on, it's going to be mandatory.
Yeah.
So if you can get it done, I would say within the first month of school, and ideally between summer, that's a really good time frame.
I would imagine that doing it before school is better just from a scheduling standpoint
100%.
because you don't have to work around the school schedule. You can,
Absolutely.
your kid is available, so you take it out. All right. So now the big question is, can we schedule a back to school physical with our residents in our continuity clinic?
Absolutely, and we would be honored and privileged to take care of our patients, especially the little ones.
Okay.
Be there for them, and you can contact us through the phone number on your screen, and we'd be more than happy and honestly very privileged to be able to provide you that care.
Excellent. Thank you so much for this education. I can't say that I knew all the specifics here, so this is very helpful to
Thank
me.
you, sir.
I hope it's helpful to our audience, and I hope to see you again on another Cup of Joe conversation about healthcare topics. So have a wonderful day.